Hello, humans. This is Michael Herrick with HIPAA for Humans, realistic cybersecurity advice for healthcare. I want to talk about this buzzword that's so common in our industry, HIPAA compliant. What does that mean? People frequently contact us and ask us about becoming HIPAA compliant. Hey, we have a new company, we need to be HIPAA compliant. Help us to become HIPAA compliant. Help us make our technology product HIPAA compliant. People frequently are asking about HIPAA compliant. People get online and they search for how to become HIPAA compliant. What does this mean? I'm not a big fan of this term, and I don't think it really means that much. It doesn't really have any legal meaning under the law. There's no place in the law that you could point to and say, if you do these things, you will be HIPAA compliant. I don't believe the phrase HIPAA compliant appears anywhere in the HIPAA law, the high-tech law, the omnibus regulations, and so on. I don't think it has a lot of meaning. It's more or less it's a marketing buzzword. It's a convenient buzzword that's mostly used by consultants. And I like to paraphrase one of my favorite movies, The Princess Bride. There's no such thing as HIPAA compliant, Your Highness, and anyone who tells you differently is selling something. There is no universal checklist of things that you have to do in order to become HIPAA compliant. There's no checklist that would be applicable to every single healthcare organization that's out there because they're so varied, they're so diverse. The standard that HIPAA gives us is not a compliance framework, it's not a compliance checklist. The standard that HIPAA asks us to meet is to conduct a risk assessment, understand the risks to the patient data that we hold, and then to implement security controls that are reasonable and appropriate to manage that risk. Reasonable and appropriate. That's the standard that we're reaching for under HIPAA. Not a yes or no, you did it, you didn't do it. Not a checklist kind of approach. Reasonable and appropriate. And that's going to be different for every organization that's out there. What's reasonable and appropriate for a small healthcare technology startup with a few hundred patient records is going to be very, very different from what's reasonable and appropriate for a large health plan with millions of member lives. Security controls that a small startup might postpone might be very reasonable and appropriate for that risk profile, but which it would be absolutely recklessly careless if a large healthcare plan or a large hospital were to defer those security controls. So you're always looking at that, and it's very fact-based and very specific to the organization. HIPAA is really a risk management framework, not a compliance framework. There are compliance frameworks out there. I'm thinking a lot about PCI, the compliance framework for credit card processing, where they really require you to do specific things and mark these things off on a checklist. Nice thing about a compliance framework is that you got real clarity. Is the check mark on or is the check mark off? Have you become compliant or not? The downside is that a compliance framework often requires you to do things that just don't make sense at your organization. It requires you to implement controls and to implement policies and procedures that really just don't fit with the way you work. That's what's great about HIPAA. That's what I prefer about HIPAA, is that it's much more flexible because it takes that risk management approach. It can sometimes be unsettling to people who just want to be told, hey, just show me what to do and I'll be happy to do it. Right? Sometimes we would like to have that kind of clarity, that kind of checklist approach. But really, I find that a risk management philosophy serves you a lot better, is much more flexible, and helps you to really put together a risk management program that works for your organization. So that's why I like that approach. And that's the approach that we take here at Matterform when we conduct a risk assessment and when we make that the foundation of the risk management program, not the HIPAA compliance program, but the HIPAA risk management program for your healthcare organization. I'm Michael at Matterform. Join me here every Tuesday for more HIPAA for Humans, and please don't hesitate to reach out if we can help you move your organization away from a HIPAA compliance mindset and into a HIPAA risk management mindset. Thanks for watching.